we started investigation into hydrogen peroxide as far back as March last year. And we've waited for evidence up to now that we have escalation in the number of cases. And we think that the observations we have made so far are quite relevant for us to come into the public domain. I heard the previous speaker referring to British Medical Journal. Indeed, we published our first paper in the British Medical Journal, July 2020, and that is that is cited in the public statement that we made. If you read that, you will get quite a bit of references about hydrogen peroxide and its effect on viruses, especially respiratory viruses, including the influenza virus. What we all just needed to do was to begin to use it ourselves. Those in the team, members of our family, our friends, and so on, to see whether really it will be helpful. And one key evidence we have, and we cited it in the public statement we issued, is that 8 nurses, frontline nurses, who are working at the Dodowa District Hospital and who just use face masks and wear scrubs and gloves to manage, first of all, receive COVID-19 patients and to manage them. 8 of them have remained negative and they've been well. They haven't had COVID over the period of 9 months. Whereas those 62 of their colleagues who are not using hydrogen peroxide have had COVID. In fact, I'm at an engagement ceremony now. And as it turned, the gentleman I sat next to works with the National Health Insurance Authority. And he made a startling statement to me. He said someone introduced it to him in June last year. And he has used hydrogen peroxide regularly. And sometimes at the office, he forgets even to use the mask. But it turned out that his colleagues became infected. And he alone tested negative. You know, when you have observational evidences like this, you don't throw them out. And the way hydrogen peroxide works is that it breaks down into water and free oxygen molecules, which are radical oxygen species. And these species would attack the membrane wall of the virus. So whilst it's in the oral cavity and nasal cavity, the oxygen molecules or radical oxygen species will destroy the membrane wall and therefore make it impossible for the virus to attach to the surface, that is the mucosa, to penetrate further. If it penetrates, then you lose the opportunity to inactivate the virus. But when the patient now has COVID, the viruses must leave to now infect others. And when they live in, they use the same routes, the oral cavity and the nasal cavity. What we are suggesting is that if someone has COVID, let the person use hydrogen peroxide. And when he or she uses hydrogen peroxide, the viruses he or she will be shedding will be inactivated viruses. So they will not be able to infect their contacts, and particularly healthcare workers. So our emphasis should be on protecting healthcare workers aside all the protocols that have been accepted to use hydrogen peroxide so we can break the chain